Diagnoses are up as women are falling behind in getting screened. So here to talk more about the trend is Dr. May Zakor from Corewell Health. Thank you for joining us.
Thank you for having me today.
Let's talk about the recommendations and the guidelines right now for pap smears. How often are we supposed to be doing this?
Yeah, good question. So there are several organizations that have published guidelines on how often to do pap smears. We generally will follow the U.S. Preventive Task Force Services, which recommends starting pap screening at the age of 21. By the age of 30, we're usually doing a combination of PAP and HPV testing. HPV testing seems to be actually more accurate, and a lot of countries have adopted that as the primary mode of screening. But definitely by 21, women should be starting their PAP smears.
And then how frequently?
That has recently changed over the past few years.
Yep.
So women are probably used to doing an annual pap smear, and that actually has changed to every 3 to 5 years, depending on how you're screening. So women often will come in asking for a once-a-year pap, but we're now guiding them, if they have been normal, that they can actually space out to 3 to 5 years.
And that's good news.
That's good news. Yeah.
Yes, it is. So what are some of the symptoms of cervical cancer?
Cervical cancer sometimes presents with no symptoms, so sometimes it's picked up on a screening exam, but some women will present with abnormal bleeding, especially what's called postcoital bleeding or bleeding after intercourse, pelvic pain, change in urinary frequency or bladder pain, sometimes change in bowel function. So any sort of pelvic symptom that's new really should be presented to a primary care provider or OBGYN.
And we do have some tools to prevent it. Let's talk about that.
So the most important thing for cervical cancer prevention is the HPV vaccination. Unfortunately, we're not performing very well as a country in administering the HPV vaccine. About 40% of people are compliant with HPV vaccination. It is recommended to give that vaccination at the age of 11 to 12, so girls and boys should be receiving that. That is the most important thing for cervical cancer prevention because most of them are caused by HPV. The other thing that should be done is screening, like we talked about. So starting at 21, women should be having pap smears started, and then HPV will be incorporated usually by the age of 30.
I recently learned that the HPV vaccine has been, you could get it up to age 45 now, is that correct?
Yeah, so initially it was approved up to the age of 26, and the FDA expanded that approval to 45. Sometimes there are issues with insurance coverage for women after the age of 26, but it should be offered, and most insurance companies will cover the cost of that. It's very important to give for any woman who's at risk of acquiring HPV.
So most of us know that we're supposed to check in with our doctor once a year. How often are we supposed to check in with a gynecologist?
So good question also. Most women are used to that once-a-year exam. With the PAPs no longer being done annually, a lot of these exams are being performed without a pelvic exam. It's not required if there's not any new symptoms. Women should still see their primary care doctor or OBGYN provider every 1 to 2 years just for other screening purposes as well. So breast cancer screening, discussing colorectal cancer screening, and the discussion about whether a pelvic exam is indicated and whether it's time for the pap smear.
Doctor, thank you so much for talking about this important topic with us.
Thank you so much for having me.
Yeah.